So we're just going to do a lesson summary, and we're going to talk about the main therapeutic approaches that exist for treating depression based on the sort of drawing from the NICE guidelines. So this tutorial is for educational purposes only. It's not designed as a diagnostic or to treat anyone or make any recommendations. Learners deploy techniques as part of a treatment plan. So the tutorial is for educational purposes only. So just for the purposes of our assignment. So first of all, we'll look at CBT. And we covered CBT in a previous assignment. So that's the main one. That stands for cognitive behavioral therapy. It's probably one of the most commonly administered therapies for depression, but not only that, it's actually got one of the most extensive research bases. And this is important when you look at the guidelines for the treatment of depression, because the NICE guidelines can only recommend treatments that have a solid research evidence base behind them. So as you know, CBT was invented by Aaron Beck back in the 80s. He wasn't a psychologist. He was actually a psychiatrist, and he was practicing psychoanalysis in treatment of some of his patients with depression. So obviously psychoanalysis can be a long drawn out therapy. Some people can be in therapy with the psychoanalysis approach for years, but Aaron Beck grew frustrated with this, and he was interested in trying to identify the main components that actually brought about change in his patients. So he identified what he thought were the main therapeutic parts of the therapy that actually made his patients improve, and then developed and refined these to become CBT that we know today. So CBT has moved on now and takes many different forms of treatment of all sorts of different psychological disorders. But Beck's original principle lies in the heart of this type of therapy. And CBT, the focus on CBT is identifying and understanding the links between our thoughts, feelings, and behavior and other physical reactions or bodily sensations. These thoughts will normally be triggered by particular situations or life events. And the aim is to help the person identify and monitor distressing thoughts and beliefs, and also develop coping skills to counteract some of these distressing thoughts. CBT has an important behavioral component. It's not just addressing people's thoughts, but we also look at the behaviors as well. Activity scheduling is an important part of therapy too. And in that, we'd be looking to increase the person's engagement, reinforcing the activities, but also looking at the activities that someone might be avoiding, because avoidance can be key to maintaining someone's depression. So in summary, CBT is not just about talking in an unstructured way. It's a very structured approach. Behavioral activation is another one. So there's perhaps you could make a case in point, there's less evidence than CBT. It's interpersonal therapy. However, it's not to say it still can't be effective for the right person. Some of the pros of behavioral activation, it's a very simple approach. It doesn't take a great degree of training, you could argue, for health professionals to be able to successfully use behavioral activation. And you don't need to be, like, for example, in certain settings, in certain environments, people don't need to be a fully fledged therapist, so to speak. It's also quite useful for patient engagement if the patient's got daily routine is completely disturbed, they're struggling to get out of bed, for example, in the morning. It's going to be very difficult for them to get down to see the therapist, for example. So some behavior activation can work. It can be useful or engaging in other therapy, such as CBT. It can help sort of adjust people's daily routine and get them back into level of functioning. They're actually able to come and engage in the therapy. Behavioral activation is also changing behaviors to improve the mood. It's much in common with behavioral elements of CBT that we discussed previously. However, there's no need to address the cognitive issue. We're just changing behaviors to help a person's mood. In some ways, you could make a case in point. It's a bit like sticking plaster therapy. And what I'm referring to is you can sort of patch a person up with behavioral activation and make them feel better to a certain extent. They probably still carry a high risk of relapse because the full problem's not being addressed, so to speak. And distressing thoughts are still there that contributed to being in that situation in the first place. So in some ways, you could say that, behavioral activation help people feel better to a certain extent, but they'll still probably, the research suggests it's probably a high risk of relapse because it's not addressing these sort of problem per se, and distressing thoughts go on in that situation in the first place. So you're just interpreting the maintenance loop by wish depression by changing behaviors. Nevertheless, this type of therapy that can be useful, and the therapy itself, the person's identified to encourage effects of their behavior and understand how their behavior is affecting their current symptoms and also the emotional states. Functional analysis is a term that you'll hear in bell activation therapy. It's functional analysis, basically looking at three things: the ABCs, the antecedents, the behaviors, and the consequences. And by that, I mean looking at what happens before a person engages in a certain type of behavior. Then B, the behavior itself and what the function of that behavior is and what form it takes. And C, looking at the consequences, what happens as a result of the behavior, or what doesn't happen as a result of engaging in that behavior. So looking at functional analysis is easily applicable, and to avoid behavior, that means behavior in terms of doing something rather than sort of not doing something rather than doing something as well. So mindfulness, which sort of covers that as well. In recent years, particularly, sort of become more popular. The mindfulness treatment, known as MBCT, which stands for Mindfulness-Based Cognitive Therapy. This is what Zindel Segal, Mark Williams, and John Deasdale pioneered. The approach is based on the original mindfulness stress reduction program, which was developed by John Kabat-Zinn. But MBCT is the type that we give, or the type that's given for the treatment of depression. So it's MBC is the one that's sort of applicable for depression as such. You've got mindfulness-based cognitive therapy. This type of therapy is important in preventing relapse, according to the research, relapse of depression. Some of the early trials of MBCT, they initially looked at the data and they thought it wasn't working very well, but then they actually looked at analysis more closely. They realized it was useful and effective, but only if you had multiple episodes of depression. So the format of the MBCT takes an 8-week program, group-based program, and during these groups, a person will be taught mindfulness-based meditation practices, and they'll also recap some of the basic psychoeducation and CBT skills for the treatment of depression. One of the two main phases of this therapy is helping the person recognize when they are in what's called autopilot mode, and this is the kind of mode people enter when they're not really paying attention to their thoughts and they're just going through the same old processes of sort of autopilot, which is often the case in depression. Meditation is used to step outside of this process, so it helps the person decenter from their thoughts and feelings, and in doing so they're able to respond more objectively and healthier ways. This is the focus of this therapy, is developing greater compassion and kindness. The other thing we sort of talked about is psychonamic therapy or interpersonal therapy, or dynamic interpersonal therapy. The acronym DIT is dynamic interpersonal therapy. Is an old form of therapy. It was used in Victorian times, developed by Sigmund Freud. Well, psychodynamic therapy, who I'm sure that you've heard of and we've talked about as well. Its reputation has probably suffered somewhat due to lack of research for the process and technique. It's quite a lengthy approach. As I mentioned in previous lectures, it can take several years somebody to finish a traditional psychodynamic approach. However, DIT is a short form of psychodynamic therapy. It can be delivered in 16 sessions. In recent years, more research has been taken place to gather evidence around the therapy. However, currently, the evidence base is not as strong as some of the other therapeutic approaches, as we've talked about before, although it may be useful for the right person in the right situation. So psychodynamic therapy is the type of therapy derived from psychodynamic analytical models of Sigmund Freud, and the emphasis of this type of therapy is past patterns of behavior and relationships and how they actually play out in the therapy room between patient and therapist. There are various processes that play out in therapeutic relationships, including such things as transference, countertransference, and that enables the therapist and the patient to revisit past conflicts, both conscious and unconscious, from the past. It's fairly non-directive form of therapy. in the sense that no specific skills are taught. It can be also take many years to complete in terms of providing on the National Health Service. There are costly issues that need to be considered. However, in short, dynamic interpersonal therapy can be delivered in as little as 16 sessions, so to speak.